Good day, everyone. So this presentation is all about the antihistaminics. So what are antihistamines? Antihistamines are a class of drugs commonly used to treat symptoms of allergies. These drugs help treat conditions caused by too much histamine. Histamine are chemical created by the body's immune system. Then antihistamines can play a crucial role in managing allergic asthma. Allergic asthma, also known as atopic or allergy-induced asthma, is triggered by exposure to an allergen. This exposure sets off an overreaction of the immune system. This is where the body releases the chemical called histamine. Too much histamine, caused by the body being oversensitive or overreacting to an allergen, causes a variety of symptoms. What is histamine? Histamine is a chemical substance that can be released in the lungs. It is responsible for allergic symptoms. In people with allergic asthma, histamine causes airway or bronchial constriction. It also causes excess mucus production, and together these effects impede airflow in the lungs. Antihistamine prevent histamine from binding to receptors that trigger symptoms in both conditions. Antihistamines have shown to have bronchodilatory effects on allergen, exercise, and adenosine monophosphate challenge testing, and also to prevent allergen-induced nonspecific airways hyperresponsiveness. It is important to note that antihistamine is not the only chemical involved in asthma symptoms. However, it can help relieve asthma symptoms triggered by histamine, which includes the inflammation, bronchoconstriction, and excess mucus in the airways. So, bronchoconstriction is the tightening of the smooth muscles of the bronchi and bronchioles. This causes the airways to become narrow, thus obstructing the movement of air in and out of the lungs. Bronchoconstriction is a characteristic of asthma. It is also the characteristic of other lung diseases such as viral infections, stress, emphysema, and other health concerns. Next, we have a list of some antihistamines: brompheniramine, cetirizine, chlorpheniramine, clemastine, diphenhydramine, fexofenadine, and Loratadine. Loratadine is a highly selective histamine H1 receptor and possesses some anti-inflammatory activity. Loratadine is protective against histamine-induced bronchoconstriction and inhibits allergen-induced early and late phase obstruction in asthmatics. Recent studies have shown that Loratadine produces a mild bronchodilation and is effective in the long-term treatment of allergic asthma. Generally, Loratadine is well tolerated by dogs because, unlike the older histamines, it cannot cause drowsiness. Next, we will talk about asthma in dogs. Dogs having an asthma attack will experience coughing, panting with a wide mouth, wheezing, and an overall difficulty in breathing. Dogs with asthma can also have a buildup of mucus or phlegm, which, if it is severe enough, can make the dog's gums turn blue due to the lack of oxygen. So for the treatment, three mainstays of treatment include a bronchodilator to open up the airways, an antihistamine to reduce the allergic reaction, and a steroid to reduce inflammation of the airways. Antihistamines that are commonly recommended include the diphenhydramine and Loratadine. Lastly, we have some of the side effects of antihistamine. We have drowsiness and lethargy. Some dogs also get diarrhea and nausea, dry mouth, and urinary retention. Urinary retention is the incomplete emptying of urine.